Hey, good morning. Happy hump day. My name is Jane Northrup, and today for my pH awareness segment, I'm going to start talking about the oral medications to treat pulmonary hypertension. And the first group is ERAs, which stands for Endothelin Receptor Antagonist. Yes, that's it. And this helps the blood vessels from narrowing. And so the first drug in that category is ambristentan, which is the generic. Brand name is Letairis. So ambristentan, as I said, is the generic name. I will refer to it as Letairis. And it was approved for treatment in 2007 by the FDA. And I believe, if I'm not mistaken, I know that Gilead is the manufacturer for Letairis brand. There are several other generic companies who make ambristentan, and I believe the generic came out in mid-2018, if I'm not mistaken. Okay, so how do ERAs work? They work by blocking the endothelin, which is a substance made by the body. Endothelin causes the blood vessels to narrow or constrict. It also causes abnormal growth of the muscle in the walls of the blood vessels in the lungs. And so the narrowing increases the pressure required to push the blood through the lungs to get oxygen. By blocking the action of the endothelin, causing vessels to relax, ambristentan / Letairis decreases the pulmonary blood pressure to the heart and improves its function. There are 2 approved doses of ambristentan Letairis, 5 milligrams and 10 milligrams. Nicole is on 10 milligrams and has always been on 10 milligrams. This medication is only available through a specialty pharmacy, so you can't go to a retail pharmacy and get this medication. It's only through a specialty pharmacy, and your insurance company will dictate what specialty pharmacy that you have to go through. And then they will contact you every month, and they will make sure that you follow all the protocol for Letairis and ambristentan. So some of the side effects include edema, which is fluid retention, stuffiness, congestion, inflammation of the sinuses, flushing, rapid heartbeats, abdominal pain and constipation, and elevated liver test. Red blood cell counts should be assessed on a regular basis, so Nicole has hers every 3 months, as it can become decreased in some patients requiring a transfusion. A decrease in sperm count has been seen in men, and women of childbearing years must have a pregnancy test each month, as Letairis and ambristentan has been known to cause birth defects in the fetus. And ambristentan also interacts with cyclosporin, which is a medication given after transplant surgery. So every month when the specialty pharmacy calls me to refill her Letairis, and Nicole takes brand Letairis, they ask me if she is on cyclosporin. And then they also ask me, did she have her pregnancy test? Now, because of COVID, Nicole, the doctor's office has been able to waive that, so she doesn't have to go to a lab and pee in a cup And so I don't know how much longer we're going to be able to waive it, but so far that has worked for Nicole. So the cost, I wanted to try and find the cost of these drugs because if you're not a patient or a caregiver for a patient, you don't know how expensive these drugs are. So I went through drugs.com, and this is where I found some information. I believe it kicked me over to WebMD. According to this, it says the generic, which is ambristentan, for 5 milligrams would cost you $2,456 for 10 days. For 30 days, you're looking at between $5,000 and $7,000. And they said it was the same price for 10 milligrams. I don't know about that. I would think that 10 milligrams would be higher, but I don't know. So this is what I'm coming up with in a Google search. So, yes, when Nicole was still a minor, I would get a printout as how much the medications would cost, how much the specialty pharmacy would charge for the medications. I don't get that anymore, so it's harder for me to find out the cost of these medications. So there you go. That is the first ERA that I am going to talk about. And the next ERA that I will talk about tomorrow is Triclair. So until next time, take care and God bless.